Welcome, everybody. We're going to go ahead and get started. My name is Carla Sumala, and I serve as co-director of the San Francisco Tech Council. And today we're going to be talking about Social Security and, in particular, digital barriers to Social Security, especially for older adults and adults with disabilities. But since the government in the last year created 100 million digital accounts, is that you need to know a lot of technology to access your benefits, and you need to have technology. At the minimum, you need a decent Wi-Fi connection. You need two working devices. You need to know what multi-factor authentication is. You need to have an email address, an email that's working. You need to know how to upload documents, and you need to know how to do a video call. That's an awful lot. And that would get even the best of us on a good day pretty flustered. At any rate, as I looked into this, I came across more recently a report in which Dr. Katie Savin, our guest today, was one of the lead authors. And I jumped out and I said, oh my God, somebody is paying attention to this issue and is thinking about it and has done some research. And so I invited Dr. Katie Savin, who is an assistant professor in social work at Cal State Sacramento.
Hey, hi everyone. Thank you so much for having me. Perfect. So this report that you just heard about, it's called In the Last Year, It's Gotten a Lot Worse, Barriers to Disability Benefits in 2025. And I can put a link later for the full report as well. You can also access it from the QR code. I did this report in with my colleagues Callie Freitag from the University of Wisconsin-Madison and Matthew Boris from the University of Binghamton at SUNY. Um, so you all may have been aware over the last year and a half, there have been a lot of quickly happening news articles about Social Security. You know, shortly after the start of the second Trump administration, first, the Social Security changed the overpayment default withholding rate back to 100%. So if you were paid too much, suddenly your whole check could get withheld. Um, Around the same time, DOJ was leading an effort to reduce the size of the federal workforce, and that included Social Security, which had um, a number of initiatives to incentivize early retirement for their most seasoned employees. This created a lot of chaos when you have rapidly changing policies and a shrinking federal workforce. People don't know how to carry out these policies, or which one's the active one at the moment. The remaining workers had less training and higher workloads. And then uh, more policies started changing that made it so people had to use phone and internet more often in order to access services they needed. This access to field offices were reduced. And at the same time of all of this, Social Security stopped reporting some of the metrics that they had previously made public facing so that the public could track what's happening. So, as a Social Security researcher, as a former Social Security disability beneficiary, as a social worker, I was very concerned that we didn't really know what was happening for Social Security beneficiaries, but that it was likely getting worse. Meanwhile, and of most interest to this group, Frank Bisignano, who in mid-2025 was made the Commissioner of Social Security and later on also the CEO of the IRS, decided to lead this effort to make Social Security a digital first agency, which is a phrase he repeats, to try to move the customer service functions of Social Security more towards the internet. So that meant a number of things. The first was if you had a login to Social Security that you created prior to 2021, you had to create a new one using this login.gov or ID.me system that I'll talk about more in a moment that I think Carla was maybe referencing before is very challenging to get. Um, and then Social Security made it so you had to use that login to do increased uh, um, encounters. So if you wanted to change your direct deposit, you could only do that in person or through MySSA. You then had to make appointments in order to get to the field office in most circumstances, which you had to do through MySSA. They also introduced an AI chatbot that automated some of the phone interactions. So if you called the 1-800 number, you were now talking to an automated bot rather than pressing a button to reach a particular person. So that's a little bit of the context. So, um, so my colleagues and I decided to try to research this. We needed to think of a way that we could communicate with people shortly after these changes happened who would have a good understanding of what was it like before all of these changes happened and what was it like after. And the people who are talking to Social Security day in and day out are the legal service providers who help people obtain and maintain their benefits. These are attorneys and non-attorneys like social workers who help people get on disability benefits like SSI and SSDI. So we interviewed 52 legal service providers from 32 different organizations who collectively represented over 8,000 claimants. And we made an effort to interview people from across the country. Formerly, SSA organized the country into 10 distinct regions. I say formally because they have since collapsed those in the light of fewer staff. But we made an effort to talk to people in all different parts of the country and rural and urban areas and big and small organizations. And we conducted interviews using an interview guide. They were about an hour each between July and September of 2025. And then we transcribed those interviews and coded them to see what some of the common themes were with our research team. So, what we found were a number of themes that I will try to focus in on the ones mostly impacting the technology. But you can, of course, read the full report for the remaining ones. So, we broadly found that while access to disability benefits has always been challenging, in 2025, it got a lot worse. We had a participant describe some of the barriers that came up as getting stuck in a loop. So changes to the phone systems. One participant said it used to be the field offices had a press 1 for type menu, and that was annoying, but fine. I could navigate it quickly enough. Within the last month, they've switched to one of the AI assistants, which is far worse, far less navigable, far less accessible. At the same time, as I mentioned, this change was actually initiated under the Biden administration. Access to field offices were restricted. Uh, One participant said, to make an appointment, you generally need a phone or access to the internet, or you need a phone that allows you to stay on to hold for a very long time because it's hard to get through, which is a big issue for people who had government phones with limited minutes. Um, At the same time, as staff were cut and reassigned, um, one participant said, I just had so many cases that are stuck in purgatory because they don't have enough workers to work them. They don't have enough workers to answer the phones to tell me what's happening to them. So, coupling these rapid changes with fewer staff meant that when the technology didn't work or people couldn't access the technology, they didn't actually have the human capacity to try to make this work for claimants. And so more errors happened. Processing took longer at every level of applications, which also meant more need to talk to staff. One participant said clients are meeting every single eligibility standard and they're just getting denied. We heard from people that there were errors happening that they hadn't seen before, where somebody would clearly meet eligibility for benefits and simply be denied. And then there was the issue of accessing someone who could do something about that. We talked to people who had been working with claimants to access disability benefits for years to decades, and they said things like, I've never seen a delay in getting paid this bad ever. So, what were the consequences of that? It could be hard to communicate when we're talking about things like changing a phone system. That sounds sort of banal, but the consequences were actually pretty dire. Our participants told us things like they're losing access to their housing, they're losing their food services. I'd say 25% become homeless while we're working with them, speaking of their clients. Another participant who worked in a medical legal partnership and worked primarily with people with cancer described an unhoused woman with terminal cancer and said This woman is dying. She's going to die. She has a very serious medical condition and she's living outside. This was somebody who was clearly eligible for benefits, but was encountering these delays. And this participant talked, described just crying after trying to get through to Social Security, knowing how badly her client needed these benefits. Um, so the consequences were dire, but not everybody faced the same type of consequences. Oh, I just saw Andrew unmuted, which made me.
Yeah, no, sorry, Katie. Richard Adler just put in the chat there, like, what is the overpayments problem and how widespread is it? I don't know if you.
Yeah, great question. Okay, so overpayments happen when Social Security gives somebody more money than they should have. And that can happen for all kinds of reasons. It can happen because of a mistake a claimant makes, or it can happen because of a mistake Social Security makes, or it can be because of a timing issue. For example, if you receive SSI, Supplemental Security Income, and then you work, and this it's such a complicated policy. So excuse me for this getting in the weeds, but when you receive SSI after the first $60, every $2 you earn, $1 is subtracted from your benefits. So, and you have to submit your pay stubs monthly to Social Security. So if I receive SSI and I earned $560, let's say for math, right? I would need to have $250 taken out of my next SSI check. Um, However, what that means is I need to send my pay stubs promptly after receiving them, and somebody at Social Security needs to receive that mail and process it. So that's a lot to happen in a relatively tight time frame, especially when uh, there's major staffing reduction. And what also happened in 2025 is that there had previously been sort of a hold on going after older overpayments during COVID-19. And that policy was sort of undone. They basically said you can resume looking for overpayments. One of DOJ's main tasks was look for fraud, identify fraud. And you may remember sort of these headlines around find fraud, find the people over 100 are getting Social Security benefits. So there were, what we heard from participants is that a lot more people were receiving overpayments that were very old, overpayments that didn't make sense, that they couldn't actually trace kind of the origins for, and that it was harder than ever to actually address them, to appeal them. That sometimes people would just not receive their check and be told, oh, you had an overpayment, but they never would have been given that notice. Um, so this is the type of thing that happened sometimes before, but just got a lot worse in 2025.
Thank
Yes,
you.
exactly as Ann Fisher put in the chat. This is the type of thing that we heard a lot, seeing overpayments from 10 to 15 years ago with no information as to why. Um, and then, when you couple that with the fact that they were changing how much you can withhold from a check in the context of an overpayment, that could create serious, material harm. Okay. Um, so in terms of these tech inequities that, we saw as really exacerbating some of the consequences, this is where the MySSA account comes in. Um, so, as one participant said, online account management is a great tool, but it's not a great tool if you can't access it. It usually, and then speaking of, the need to have an email address to set up a MySSA account, it said it usually takes about an hour to an hour and 15, 20 minutes. I can't sit there and set up everyone's email. A lot of people told us that their clients needed emails, they didn't have time to help them set them up. Um, Another said, most of our clients have not been successful at creating accounts. It prevents them from this whole world Social Security is envisioning, makes things easier. And it is true, if you can access that account, it does make things easier. The issue is that the very people Social Security is designed to serve are vulnerable older and disabled adults. And they're the very ones that this was often difficult for. In describing the experience of trying to get a MySSA account, someone said, you have to hold up your license like to the camera Um, and a client couldn't figure out where to point it. And so where I was like, let's just call them. And at this point, we spent more trying to get him to flip his ID. And in the end, we couldn't. This quote might not make a ton of sense if you haven't gone through this, but when you try to create one of these accounts, you're told hold your ID up so the camera can see it and then turn it around. And they were trying to describe to their client how to do this, who was struggling a lot. Um, another respondent said, if your challenge is a behavioral health challenge or a cognitive challenge, like God help you. I mean, it's just hard and frustrating, and there's not a human that you can feel like at least you can try to explain yourself to. So, a number of participants described that their clients who had psych disabilities or cognitive disabilities struggled in particular to sort of manage just the frustration, to have the emotional regulation to persist through these challenges in order to be able to access the services. And then speaking of the AI chatbot that answered the 1-800 number, some people spoke of barriers that their clients with communication disabilities had. One said people who have any sort of speech or hearing issues are not going to be able to navigate that menu effectively at all. We heard from one respondent who said that they had a client with speech impediments who would come into the office just to call Social Security because the AI chatbot couldn't understand their speech and they couldn't simply press a button to navigate around it the way you had been able to previously. Um, There were also new issues and new barriers that came up for immigrant communities. Um, a number of respondents talked about their clients who were from immigrant families, particularly mixed status families, who had questions for them, like, is it safe for me to apply for benefits? Is it safe for me as an undocumented parent of a citizen child to be the representative payee? And this was something that a lot of advocates weren't sure how to support their clients around. One said, I mean, it's hard for advocates to help families to think about and assess unknown risks. Has there ever been a fear before now that SSA was going to comply with some crazy order to share all kinds of data? No, there hasn't. Um, and unfortunately, since the time of this interview, we do now have information that SSA has shared data. Um, with DHS, which is validates these fears and it makes it very difficult to navigate accessing benefits you're entitled for, particularly when you're from a mixed status family. There was SSA workers were at one point instructed to let ICE know if an undocumented client had an appointment at a field office. And I see in the chat, AI chatbots are incredibly frustrating. Yes, they only understand a limited range of inputs, and if you don't fit with those, you get nowhere. Precisely. Yeah, that is what we heard too. So, um, at the same time, as all of these issues were happening, the strategies that advocates had used for years to try to escalate when there were issues were no longer available to them. One person said, as quickly as we have a contact, they're gone or they're retired. It makes it doubly hard getting anything done. We don't know where the expertise is in an office to get the answers that we need. Um, with quickly changing staff as people retired early or left or were reassigned. Um, Having those contacts had been a critical strategy. SSA is not an easy agency to penetrate, so when you had a personal relationship, that was often how you got something done as an advocate, but those relationships in so many cases were no longer there. Another person said, when we encounter very egregious mistakes or errors, which, as I mentioned, had become more frequent, now we don't have anybody to go to for that. So we had 6 independent respondents use the term black hole to describe what this felt like to them, like screaming into a black hole, which was very striking to hear. One said, my hands are completely tied. I feel like a gag order. It's really depressing. We, up until this year, had multiple ways to escalate the case. Um, Another said, I'm convinced there's a great big trash can underneath the fax machine. Even when we're doing electronic filings, electronic appeals, they just kind of disappear. Respondents talked about feeling a lot of desperation and hopelessness, right? honing strategies for years that in many cases they found were no longer working. And and so I'll just briefly share this final theme around the impacts of advocates and organizations. People found that when they represented clients, the amount of work they had to do was increasing dramatically, as some of that work was sort of being shifted from Social Security onto them. They said we have to make 4 phone calls when we send one piece of paper to make sure it's received and processed and understood and interpreted in a way that helps the client. And again, these issues were not seamless before, but they got a lot harder in 2025. Um, Someone said it used to be that if something went wrong, that's when you needed a lawyer. Now we're needing an attorney to make sure something gets off someone's desk. So these simple due process issues of submitting an application became issues for legal intervention. Um, and as somebody explained, the impact of this was if you're doing that with a number of cases, it's really cutting into the number of cases you can competently represent. And that meant, that people feared there were more clients going without representation. And if the advocates were having this much trouble reaching Social Security, everyone worried, what must this be like for clients who are unrepresented? So we conclude our report with a number of recommendations for Social Security that I won't go into in depth now, but I think of most relevance to this group. We recommended staffing up in order to achieve certain customer service goals, like be able to make an appointment within 30 days, to expand walk-in services for people who didn't have access to reach Social Security by phone or on the internet, and to have the alternatives to these online and AI-based systems. Um, so I'll conclude with some strategies that I drafted for you all in thinking about this group. And first one is know the exception for walk-in field office visits. So this, different field offices differ, but in 2025, policy changed so that you couldn't simply walk into a field office and expect to get help. You, for many cases, needed to have an appointment. And those appointments, of course, were hard to get. You sometimes needed internet or phone that you could be on for a while. However, there are exceptions to this that were not always enforced by field offices themselves, such as not being able to navigate these alternative ways of reaching Social Security. So I have, and I will put in the chat a document that from Social Security that lists what these are so that you can be aware of them and make sure that your clients are educated, or that if you are going with your clients into Social Security, that you can reference this. I hope that linked work. Let me know if it doesn't. I also would recommend supporting clients in establishing an email address and a MySSA account before they need it. As mentioned, this could take a long time to do, and will certainly help you help them to access services. Warn clients who may be calling Social Security about the new AI bot that allows you that is what first answers the 1-800 number. At the time of the interviews, this could have changed now. Repeating the word agent was what allowed people to bypass it. So I would give that a try, see if that's still the word, and then tell your clients to try repeating that. Get to know people at your Social Security office, whether, bring by a box of donuts, ask them how it's going, acknowledge that they're now doing a lot more with fewer staff. They've maybe lost colleagues in this, and that this is stressful for them. Make personal connections that you can help leverage for your clients, and be persistent in your communications. Be a squeaky wheel. That is what, a lot of lawyers found themselves doing all day. Stay up to date with the emergency messages from Social Security, and I can put a link into those because the policies change fast, and knowing what they are is helpful. And then escalate where necessary. And I will also share in the chat a document from Justice and Aging that gives you some recommended strategies on how to escalate issues within Social Security. Um, And I will stop there. There's another QR code to the report and just an acknowledgement of our wonderful research assistants who helped make this possible.
Thank
Something I didn't have a chance to mention early in this presentation is that there was barriers sort of at every step of the way of establishing that account. First you've you have this confusing choice of login.gov or id.me, and either work, but why would you have, it seems like there should be a difference. When you have to verify your identity, it will give you, the type of question of have you ever lived at any of these addresses, which you may be familiar with. And for people who are unstably housed, maybe have a history of 10 different addresses in the last 5 years and also have cognitive disabilities, they won't know. And those systems are designed to give you very similar addresses. So they're extremely confusing and difficult if you have memory issues, cognitive issues, um, and then the simple kind of fact of the tech issues to navigate through it makes it really challenging.
what have you seen at Conard House, Nancy, if you'd mind sharing?
So we do representative payee services for quite a lot of people, and we have seen a dramatic increase in just how hard it is to get a hold of anybody at Social Security. Anecdotally, we had a bunch of very old overpayments that came in, and so I did all the research on them. We submitted the waivers. Then 2 months later, we were told we never got those waivers, so we submitted them again. So then 3 months later, we were told, no, we never got them. What are you talking about? So we submitted them again. The other thing is now the phone system starting, I believe, May 1st, they told me, was when you call, your call could get routed to anywhere in the country now, even if you are calling a local office. It's whoever they have available anywhere in the country. And we often get people that are like, I can't tell you about that because I'm not in California, in San Francisco, and I don't know the answers to these particular questions. So yeah, it's just been very, very difficult. There are a lot of barriers.
Tiny solace. There was so much pushback against that. They've actually pushed that out. They said they will do a pilot in the future, but that calling and getting anyone in the country is absolutely a problem for the reasons you said, and there wasn't really a plan on how to address it in place. So we have some time.
Yeah, I do know, unless they rolled it back as well, though, we have gotten people in other places in California too. I guess the first step was other places in your state, and then the next step was anybody in the country.
Yeah, so it was they're kind of two different processes, bizarrely, even though it does seem like one would be progress. But yes, it's a huge issue, right? You call one field office, and if somebody doesn't answer, they were so concerned about kind of the media they got around long phone wait times, that then they could send it to a different field office within the region. But then, of course, as I'm sure has happened to you, that happens and they say, oh, well, we don't have the information that you need because you need to call your local field office. And then you say, oh, I did. So, yeah, very.
That was exactly the conversation.